Hello, everyone. Thanks for joining. We're going to wait just a minute or so to let folks join before we get started. Hi, everyone. Thanks for joining. We're going to just give it a few more seconds to let folks get on, and then we'll get started. Okay, the first part of the agenda is mostly introduction, so that'll give everyone time to get on before the meat of this webinar starts. So let's get started. Hi, everyone. My name is Peggy Bailey. I use she, her pronouns, and I'm the Vice President for Housing Policy at the Center on Budget and Policy Priorities, and I will serve as today's moderator. I really welcome to the third installment in the webinar series. This one is the long-term solutions to homelessness and housing poverty. Due to the way that we fund housing in this country, we operate generally in an environment of scarcity. We know the solutions to solving homelessness and housing instability, but unfortunately, we don't have the resources to go along with those solutions, which means that we have to choose between. It means that rather than being able to give people what they need, we have to say who needs help the most. And that is one of the biggest challenges that we face right now. It can often look like we're not solving problems when we most definitely are. We know that housing first is the best strategy to ending homelessness. It gives people a place to live first, a place to stabilize their lives, a place to take a deep breath, while we then wrap services and supports around them. But we need more rental assistance, more funding for the services and supports, and we need long-term strategies that help keep those things in place while also adding to housing supply. So that's what we're here to talk about today. What are those long-term strategies that, what are the issues we're facing, and what are the long-term solutions so that we can all rally around those and keep up the momentum for increasing resources, both that are federally funded, but at the state but what's happening increasingly is increasing resources at the state and local level as well. Along with myself and Diane Yantel, you'll hear from Lisa Glow, who is the CEO for Central Arizona Shelter Services, Mindy Woods, who is a resident in Seattle in housing, and you'll hear about Housing First successes from Catherine Monet at the National Coalition for Housing for Homeless Veterans, and John Meyer, who's Support Services and Veterans Families Program Manager with West Central Texas Council of State Governments. So we'll get started first with some overview comments from myself, and then I'll pass it to Diane. So next slide, please. Next slide. So as you hear from the panelists today, we want you to focus on 4 of the major solutions for homelessness and housing instability. First is bridging the gap between incomes and housing costs. Embedded in this is a recognition that people are working. The people who can work, who aren't too young to work or have or have reached an age where they're ready to retire, or people with significant disabilities are working. And there's just a gap between what people are making and rents. Second is to expand and preserve supply of rental homes. It's key that we can't, that in addition to expanding, we have to focus on preservation, because if we're losing more units than we're gaining, then we're just treading water. Third is to provide emergency rental assistance to households. This is crisis intervention with a recognition that sometimes what you're making and even if you're receiving HUD assistance, what you're receiving, there still may be a need given like inflationary costs, a crisis at home, maybe your car broke down, other things like that, that you need a little bit of extra help to pay the rent. And that's what we're finding, that's what we've learned with the emergency rental assistance program that was developed under the pandemic, and trying to figure out a way to sustain those great interventions that have been implemented. And then fourth is strengthening and enforcing renter protections. Next slide. So let's dive in first into the income piece. As this slide shows, the rental crisis and affordability crisis is not new. We have seen an increasing gap, or we've seen a consistent gap between incomes and rent costs for more than 20 years now, which shows that, you know, we can't, the difficulty of trying to make up this gap simply by thinking that people will just work more. There's a fundamental gap between what people earn and where rent costs are. Next slide. And what we know is that federal rental assistance is not making up this gap. Only about 25% of people who are likely eligible for federal rental assistance receive it. And you can see from this graph what that's resulting in. There's a significant number of people who do not have a disability, are not elderly, and don't have children who go unassisted. But increasingly, families are also, the voucher program is serving fewer and fewer families as well. We've got to do more to close this gap for assistance for people with to help close that gap between income and rent costs. Next slide. To drill down further, we can see that working minimum wage isn't enough to be able to afford housing. The Low Income Housing Coalition's Out of Reach report shows this in glaring detail, and that's what's helpful about this map. The darker the colors are, the bigger the gap between a minimum wage worker in that state or locality being able to afford a one-bedroom rental home at fair market value in this last year. So you can see there are very few places that have a lighter color where you could work about a 40-hour week and still afford even a one-bedroom. And that doesn't account for the fact that most families need more than a one bedroom if there are parents and their child at home, and if there's only one worker in the household, they're going to have to work even more hours in order to afford a place to live. Next slide. And oftentimes there's a misconception that there's something we can do to help people be better or do better in order to be able to make more money. And that's a false narrative. People are working very hard at jobs like secretarial work, financial clerks, movers, retail sales workers. You can see that these workers are not making enough. These people are working, but unfortunately, they're not being paid enough to be able to afford a place to live. And that's why there has to be a recognition that rental assistance can't be determined upon who's deserving. It has to be about need and people and serving everyone who needs help paying their rent. Next slide. And that's why the coalition, the National Alliance to End Homelessness, and the Center on Budget and Policy Priorities support moving us to the day where we have universal rental assistance. It has to be central to the way that we solve homelessness and the housing crisis. And much of that would be through the Housing Choice Voucher Program or a similar program, and can be started with initiatives at the state and local level to increase rental assistance. But we recognize that more money isn't the only piece of the puzzle to getting to a well-run universal rental assistance program. We need to help communities use small area fair market rents in order to increase choice and availability and allow assistance to be able to be used in all communities. We need to simplify applications. We've learned a lot about how we can do this through implementation of the Emergency Housing Voucher Program. We need to establish and aggressively enforce fair housing laws and make it illegal to discriminate against people due to the fact that they have a voucher. We need to provide resources to all eligible households and make sure that it's not just the rent that gets paid, but helping with utility costs and other pieces. Helping people who are exiting out of the criminal legal system have access to housing, because we know that that's the primary way we can help with recidivism, and generally working on increasing incomes and assistance for families so that they can afford to meet their housing needs, but other basic needs to be able to thrive. Next slide. Along with that is crisis help, as I mentioned before, helping people with the emergency rental assistance. What we've seen is how vouchers and rental assistance can work in tandem with emergency eviction prevention assistance. And so we're also looking at ways that we should fund emergency rental assistance. We think that the federal program that was created out of the pandemic will run out of funding largely sometime next year. States can use their state and local fiscal relief fund dollars to also help these efforts. But all three of our organizations are working to identify how we can sustain the great work that all of you have been doing over the course of the pandemic to alleviate evictions for millions of people. Next slide. And so with that, the legislative opportunities that we want to make you aware of are the things that are most immediately in front of us. During this year, Congress will need to advance an appropriations bill. We hope obviously the end of this, what will happen is at the end of this month, there will likely be a continuing resolution that continues the government operating past September 30th. And then our expectation is that an appropriations bill will pass before the end of the year. Fingers crossed. And so what we all need to work on is making sure the appropriations numbers for housing and homelessness are as high as possible. So that includes increasing funding for the voucher program, increasing funding for the homelessness assistance grants, and also making sure that there's more funding available for public housing, legal aid assistance, and that tribal entities also have the housing resources that they need. And with that, I will pass it to Diane.
Great, thanks, Peggy, and hello, everybody. Really appreciate you all continuing to join this webinar series. So as Peggy described, and as we've heard throughout this webinar series, homelessness is a housing problem, and ending homelessness requires that we address our country's shortage of homes that are affordable to its lowest income people. So nationally, we have a shortage of 7 million homes affordable and available to the lowest income people. Another way of saying the same number is for every 100 of the lowest income households, there are just 36 apartments that are affordable and available to them. And because there is such a shortage, and because the federal government only funds housing assistance for 1 in 4 households in need, over 10 million of the lowest income renter households pay at least half of their very limited income to keep a roof over their heads. And you can see from this map that the shortage most severe to least severe but there is no state with a sufficient number of homes that are affordable to its lowest income renters. Next slide. So this pattern of the greatest and the clearest need for more housing affordability for the lowest income people shows up in every state, every metro area, every congressional district. And in fact, extremely low income households are the only segment of the population for which there is an absolute shortage of homes that are affordable to them. So as we advance solutions for housing affordability, we have to ensure that these investments are targeted to solutions that make homes affordable to the lowest income people. Next slide. So in addition to expanding long-term and emergency rental assistance, as Peggy discussed, Congress needs to do more to expand and preserve the supply of deeply affordable homes. So we urge Congress to expand the National Housing Trust Fund to at least $40 billion annually. The National Housing Trust Fund is the country's newest and most effective capital program that is exclusively to build and preserve apartments affordable to the lowest income people. And it's a very successful program, but it is woefully underfunded compared to the need. It should be significantly expanded. Congress should also provide at least $70 billion to preserve public housing. Our country's public housing infrastructure has at least $70 billion in needed repairs just to keep these apartments in decent, sanitary, safe conditions and to preserve them for today's and future generations. And we need to build more apartments, period, in some communities. In many high-cost, low-vacancy cities, there are simply not enough apartments for all the people who want to live there or who do live there. And when demand so far outstrips supply, costs rise for everyone, squeezing the lowest income people the most. So local communities need to do more to remove restrictive zoning laws, and the federal government should use levers that it has at its hands, especially major federal transportation investments, to incentivize or require zoning and land use reforms. And as we do all of this, we have to ensure that these investments prevent displacement, ensure that homes are accessible to people with disabilities, prioritize nonprofit ownership, build and preserve in all communities to give people greater choice of where to live, and reduce barriers that prevent marginalized people, including people with criminal records, from being able to access homes. So many of the needed investments that both Peggy and I talked about were included in the House-passed Build Back Better Act. Build Back Better would have provided major funding for the Housing Trust Fund for public housing repairs, and it would have put us on a path towards universal rental assistance. But as you all know very well, these badly needed investments were not included in the final reconciliation bill, the Inflation Reduction Act. So we need to keep pushing for these investments in future bills. Next slide, please. And finally, the fourth of the four buckets of solutions that Peggy mentioned at the beginning is renter protections to rebalance the power that currently tilts so heavily in favor of landlords and at the expense of low-income renters. To rebalance that power, we need permanent and robust tenant protections, such as prohibiting source of income discrimination, establishing and funding a national right to counsel, creating just cause eviction protections, expanding the Fair Housing Act to ban discrimination based on sexual orientation and gender identity, increasing unrestricted resources for legal services, and ensuring access for people exiting the criminal legal system. Next slide. So with a reconciliation bill over, Congress will work on and potentially pass two more big bills this year that could affect affordable housing. So there's the appropriations process, which Peggy talked about, and there's likely to be a tax extenders bill before the end of the year. That gives us an opportunity to potentially include an expansion of low-income housing tax credits to build and preserve affordable housing. But it's essential that any expansion of the low-income housing tax credit program includes bipartisan reforms that are needed to better serve extremely low income and other marginalized households. So that's something also that we'll be working on in the next few months for the remainder of this year. Next slide. We have a toolkit available. We've shared on previous webinars. We included the link here again for you with lots of information on these legislative opportunities and talking points and other resources that you can use to help us advance them. Next slide, please. And then while we are urging Congress to act, the Biden administration needs to act too. Low-income renters truly are struggling as pandemic protections have expired and as these historic emergency rental assistance that we collectively achieved is depleted, just as costs are increasing and rents are skyrocketing. And remember, as we've talked about in previous webinars, the Government Accountability Office has found that every $100 median monthly rent increase can lead to a 9% increase in homelessness in that same community. And last year, on average, rents increased monthly by $200. So the administration has to use all available authorities to prevent rent gouging and to keep tenants housed. So we're urging them to take these immediate actions, including establishing anti-rent gouging measures, expanding renter protections to properties that have federally backed mortgages, holding landlords accountable for abusive practices, continuing emergency resources that we had during the pandemic for people who are experiencing homelessness, and encouraging jurisdictions to do more with their state and local fiscal recovery funds to address housing instability and homelessness. Next slide, and last slide. So last year, the National Low-Income Housing Coalition, together with many of our national, state, local, and congressional partners, launched the Housed campaign for universal, stable, affordable homes. And we're working together to advance anti-racist policies and achieve the large-scale sustained investments and reforms needed to ensure that renters with the lowest incomes have an affordable place to call home. And many of you are already very active participants in the Housed campaign. If you aren't yet, I urge you to get involved as we work together towards achieving all of the solutions that we discussed today. So Peggy, I'll turn it back to you to facilitate any Q&A that we have time for.
Great, thanks, Diane. And we do have a few time for a couple of questions, and I'll start with one question for you. I think when looking at additional housing choice vouchers, is there also a focus on providing gradual decline in benefit voucher amount versus a benefit cliff where people are concerned that they will make themselves ineligible with too much income?
Oh, that's an interesting question. Peggy, I might actually see if you wanted to answer that based on what the administration is working on or otherwise.
Yeah, no problem. So yes, if you haven't seen, we can put in I can put a link into the chat where the administration is thinking about this. We've a couple of weeks ago, they released a economic justice initiative, which it seeks to build on the lessons learned from the Family Self-Sufficiency Program, the Ross program, and the Jobs Plus programs. To looks at what I mentioned before about HUD recognizing that people that focusing on trying to help people work more isn't necessarily proving to increase income, because it's not that people aren't working. They're just not making enough. They just aren't paid enough to afford rent. And so instead, what HUD is looking at are strategies that help renters save money while still maintaining their assistance. And then and also doing other strategies like helping people build credit histories through rent reporting, and making sure that that we can develop strategies that involve rent reporting that help those who it can help, but doesn't hurt folks who are struggling to pay their rent. And so that's the strategy that the administration's laid forward, and that we're at this we're all very excited about, right? This a pivot to help to recognizing that families that there's not that families need a focus on their strengths, and that things like financial coaching and other things are things that all of us benefit from, and that families that receive HUD assistance aren't any different. And with savings that can ease, it's with savings that aren't counted toward rent calculations, can help ease the path toward not needing assistance at some point. So let's see, we have time maybe for one more question out of the chat. And there's a question about right to counsel, and what about right to counsel? And we should include this as a strategy. Displacement homelessness starts with protecting existing tenants from eviction. And I think that's completely right, and falls in line with some of the legal assistance that I mentioned as a part of our appropriation strategy, and the tenant protections that Diane mentioned as a part of her presentation. That recognizing that. But I think also what we're learning from the emergency rental assistance programs is that the things that help tenants pay their rent also help landlords pay their bills and get their rent paid, right? And so looking at the strategies, that the way that I think about it, is the same as many services courts. So shifting evictions from being a punitive eviction court, from being a punitive place where people are penalized, to more of a services oriented court where people are connected to the services and supports and extra resources that they might need to pay their rent, is a win-win for all folks, and for everyone. And being able, and a key piece of that is counsel and legal aid assistance. So we may have time, so keep continuing to put questions in the chat as we move throughout the presentations. But our next speaker is Lisa Glow. And as I mentioned, Lisa Glow is the CEO for Central Arizona Shelter Services. Lisa, I'll pass it to you.
There we go. Had to unmute myself there. Good afternoon, everyone. I really appreciate being here, and look forward to telling you about something different, which is the history of a state bill in Arizona last year. So next slide, please. So this is our capital here in Maricopa County. Central Arizona Shelter Services is the largest and longest serving homeless emergency shelter in the state. We have an adult shelter that now has 600 beds in downtown Phoenix, a family shelter, 150 beds, a Glendale Navigation Center that opened in the pandemic, and then we're opening another shelter in 2023 and then in 2024. So just really quickly, here in Maricopa County, we've seen a 34% rise in unsheltered homelessness over the last 2 years, which is the largest we've ever seen in the unsheltered count, and we're the fastest growing county in the nation. Even more relevant, Phoenix is the 5th largest city in the nation, and we currently have an encampment of between 800 and 900 people outside of where CAS is located, our adult shelter on the Human Services campus. So keep that in mind as we go through the history of this bill. Next slide, please. So last session, Senate Bill 1581 was introduced. It was a Cicero Institute bill. They're a conservative think tank out of Texas who are working on these bills across the nation. It was sponsored by Senator David Livingston, a Republican. It would have provided $50 million to establish sanctioned campsites, $30 million for the sites, $20 million for outreach teams. There was concern about the anti-camping ordinance enforcement language, which I put here on the slides. Basically, if a municipality or county received a grant, they could not continue with funding if they did not enforce ordinances in place that prohibited sleeping and camping in public places not designated as sanctioned camping sites. There were other concerns with the language. First, requiring law enforcement to be part of outreach teams. Second, requiring people be screened for substance abuse and mental health issues if they wanted to access a sanctioned camping site. And third, requiring nonprofits to enforce ordinances. We would have had to enforce the laws. Next slide. So I want to tell you about how I got involved. I was invited to the table by Senator Livingston to provide input after the bill was drafted. I had been working with Livingston since 2019 in efforts to secure legislative funding for a senior shelter, which is what we're going to open in 2023, and operating dollars for homeless shelters statewide. Here in Arizona, very little funding goes into the operating dollars for emergency or transitional shelters through a state department. So we've been trying to increase that amount because it's going to be even more imperative now that more shelters are coming on. How are we going to find those operating dollars? And we're going to face this all across the country, I believe. All the pandemic dollars were invaluable, and now a lot of those are going away. So Livingston got engaged when I started talking to him about rising street deaths. Last year, we had nearly 600 in our county. Rising unsheltered numbers and the rising number of senior citizens becoming homeless. We had put a lot of focus there, and that really captured his concern. On the bill, I agreed to help if they agreed to make substantial amendments to the bill. So just, I want to note some lessons in this that I wanted to share. Building relationships across the aisle is critical, and knowing what our elected officials care about. And Senator Livingston and I built a really good relationship over the last couple of years because we found common ground. Also, educating our elected officials is crucial, and getting a seat at the table where conversations are happening. And there are more Cicero bills around the country, some that have passed with some pretty harsh language as well. Next slide. So Livingston agreed to support and negotiate amendments to the bill. There were a lot of stakeholder meetings that were held, and a number of positive amendments were made to the bill after that input. And this all happened on the Senate side because the bill was introduced in the Senate. The Arizona Department of Housing was put in charge of grant disbursement. People trust them. They know they'd put a process in place. The word consortiums was added so municipalities and counties could get together if they wanted to apply for grants together. More importantly, the requirement of law enforcement being involved on the multidisciplinary teams was removed. I was able to explain to the senator, law enforcement is already understaffed. It doesn't make sense for them to do this, and they're not the experts in outreach. So there were a lot of different arguments against this that resonated to have this removed. It would not have been good to have law enforcement being at the front end. So that was removed. The requirement that nonprofits had to enforce the laws was removed. That was an easy one to get out. We were able to get out the language that individuals would have to be screened for drug use or mental health challenges and replaced with low barrier language, simply a matter of educating Livingston on what that meant. And then importantly, in addition to sanctioned camping sites, we got language in there that would allow things such as tiny homes or other low cost structures to be funded under the bill. So it could be pallet homes, sprung structures, things like that. Next, please. As an aside, the Cicero lobbyist was present for all of this. And Cicero Institute, they love the Austin Community First Village model. They like tiny homes. So there was no objection to adding tiny homes into the language. So after it passed out of the Senate, and there were enough Democratic votes for this to pass out of the Senate over to the House, negotiations really accelerated because Martin v. Boise was still at the forefront of concerns. The critical thing that happened was the Arizona League of Cities and Towns got very involved, as did the city of Phoenix and Glendale. Other cities started to weigh in as well. There was a group limited to 10 by Livingston at that point to negotiate new language because there was still the enforcement language, camping ban enforcement. Cicero's lobbyist was present for all of this. And then the bill was completely rewritten ready to be introduced for a final House floor vote by Representative Ben Toma, Republican. A City of Phoenix contract lobbyist did most of the rewriting along with the League of Cities and Towns. I wasn't as involved in the rewrite, but I was aware, and it was really getting to be something that worked for the cities, which was critical. And then just a few days before the end of session, when we were hoping it would be introduced for a final vote, the bill was held by 2 Republican lawmakers because the language on ordinance enforcement had been removed. And we're pretty sure Cicero lobbied against that. I saw them in town working on some of the Republicans. So they created a divide among the Republicans. Next, please. So I'm not going to read all of this, but the language of the bill, if you are interested, you can find it. It was put out by Ben Toma. The amendment with the group revisions significantly broadened what could have been funded. The intent here to safely move unsheltered individuals experiencing homelessness off the street and into unsheltered sanctioned housing, I'll tell you about that in a minute, or other sites that provide security and services. Next slide, please. So key aspect to the renegotiated bill: remove requirements that cities enforce camping ban ordinances. That came out, renamed it unsheltered sanctioned housing versus sanctioned campsites. That's something the lobbyist at Phoenix came up with. And then here's how it was defined. It would include sanctioned campsites, tiny homes or similar low-cost structures that can be assembled quickly, and an existing structure owned by a public or nonprofit entity that can be adapted for congregate or non-congregate shelter. Pretty much anything at that point. It could have been emergency shelter, hotel shelters. The city of Tempe wanted to be able to access these resources for hotel shelters, so on and so on. So it was significantly broadened. Next slide. Here's what was also critical to this. There was sections defined special service areas would have received the largest amounts of funding. I mentioned the 900-person encampment. Phoenix wanted to be able to carve out, if possible, a larger amount of funding to help with services and setting up structures for that challenge to address that encampment. So if you were a city of at least 1 million persons in a special service area, you would get the largest amount of funding. There were a lot of other parameters in this. You'd have to define the boundaries and census and et cetera, et cetera. Go to the next slide, please. And here was the trade-off. In exchange for the language on the encampment enforcement coming out, the cities agreed to reduction goals. And these were what they came up with. For the special service area, if it's 1 million or more persons, in the first year, it'd be a 20% reduction in the unsheltered count. In the second year, a cumulative of 65% over 2 years. There were a lot, I'm not going to go over all the language, but a lot of language put in by the city of Phoenix that would have helped define it in a way that they could have succeeded, looking at the point in time count. And it got a little complicated, but they said that would work for them. And then other than special service areas would have to do a 15% reduction in the first year and cumulative 40% in 2 years. Now, this is only if they were to take the funding. At this point, Cicero was seemingly on board with these reduction goals in exchange for the camping ban language coming out. There also was no clawback provision. So if a city took the funding and did not achieve the goals, they didn't have to give back the funding. There was also no mechanism to really enforce their failure to achieve those goals. The Department of Housing was in charge of it. So there were protections for the cities written into this. The one thing I forgot to mention is the funding would have been through the American Rescue Plan. That was what was initially envisioned. And then towards the end, the funding was going to come out of the state general fund, which would have been far preferred. And then this is what we talked about as a group and that Livingston was committed to. And then we would have sought to leverage it with ARPA funding through the governor's office. Next slide. There were a lot of non-controversial provisions, and some of this was in the initial bill as well. As you can see, unsheltered sanctioned housing, this was in that final bill, included sanitary facilities, water, weather respite, 24-hour on-site security. That was very important to some of the Republicans. We'd have to integrate into coordinated entry, low barriers I mentioned, a way to camp and store personal property, and then rules for the safety of the residents and stored property. So next slide, I think this is about the last, almost the last one. So there was some good news and bad news out of this last session for us. Senator Livingston being willing to negotiate the language of Senate Bill 1581, I saw as a positive. And he in fact had the votes to pass the rewritten bill. And I do think if it had made it to the governor's desk, he would have been hard pressed not to sign. Our governor, Republican Doug Ducey, did favor the enforcement language, but I think he would have signed this bill if it had made it to him because there would have been enough Republicans voting for it. Senator Livingston also put forth a package for both homeless and housing funding, and this was done with some of the Democratic colleagues who've been long-term supporters of adding to our housing trust fund. So the good news, the best news that came out of the session is the intense focus on homeless and housing, and the Arizona Housing Trust Fund got $60 million out of the general fund to build housing. That's the largest increase in, I don't know how long, and the Arizona Housing Coalition was instrumental in lobbying for that. The initial request was $100 million. There was also something that came up at the end of the session, out of nowhere, but it was good to see. $10 million was allocated from the general fund in a grant match program for workforce programs supporting the homeless. And this was City of Glendale mayor has a program he loves, and he negotiated this with some of the Republicans. So that came in at the kind of at the end there. The threats going forward are Senate Bill 1581 could be reintroduced this session in a more conservative form. We don't have as many moderates. We have more conservative Republicans, so we could get a worse form of the bill. Or we could see a hardline bill on the ballot. We've heard Cicero talk about that. And lawsuits also are a threat. There is a lawsuit now against the city of Phoenix for the large encampment that I mentioned to you. They're being sued for a declaration of a public nuisance. I don't know if there are any other lawsuits that have focused on public nuisances, but if it becomes a declaration, there are a lot of actions that the city would have to take. I'm suspecting the neighborhoods and businesses in the surrounding area who brought this lawsuit will want to negotiate a settlement. They had been meeting with Phoenix for many, many months and probably even years to try to get some action going forward. And a lot of things have happened, but they're still seeing the need. Okay, one more slide and then I'm wrapping up. So something that we're very proud of is that Senior Haven shelter is coming in 2023. It'll have 170 beds. And this is in large thanks to Senator Livingston. We didn't get a state appropriation, but an ARPA grant, but that's how he first got engaged because he really cared about our seniors. So stay tuned for that. And thank you. I'll answer questions if there's time.
Yeah, thanks, Lisa. I do have a couple of questions that I think will be helpful given the questions in the chat. First off, is there anything or advice that you have? What should advocates know about the Cicero Institute and their tactics?
Well, I think I was surprised that I thought they were with us until the end and they weren't. So that was disappointing. I think they do support more than just structured camping. They are big fans of the Austin Community First Village. I would like to know more of what they would support, a way to find middle ground. As I understand it, they're going to keep going and try to introduce bills in other states. So we as advocates need to get in there and advocate why certain things would be harmful to the populations that we serve and why it wouldn't work, which is where I was involved. Those are a few things.
Well, and I think that's my follow-up question. So on that, what are the messages that you used that worked about why the some of these provisions would be harmful and what would be more helpful?
Yeah, it was, a lot of it had to do with having built the relationship with Senator Livingston and building trust. He held me out as his homeless expert, which as I said, I wasn't looking to be involved. They invited me and I got involved. I think taking the time to really educate our elected officials on the need to help get more people off the streets. We can't build the housing fast enough, but we need to, under Martin v. Boise, provide better options for people. And I think better options are not just structured campsites. It doesn't mean that we shouldn't support people who are in campsites now, but we've got to work towards better options. That resonated. And that's why we were able to add into the bill other language for tiny homes and other things. So educate them on Martin v. Boise and have the cities at the table, because the cities, we could have defeated this bill if it had like gotten into the bad version and then we could get all the Democrats to vote against it. They wouldn't have the votes. But educate on Martin v. Boise, educate and find out what those electeds care about. Involve the neighbors. Sometimes we forget about the neighbors. The neighbors wanted the initial version of the bill, and I worked with some of them to educate them why it would not fly, why it would never pass. With the language that they liked on the camping ban, it'll never pass with that. You've got to, so it's a lot of education and communication.
Thanks, Lisa. And I really appreciate that. Great presentation. And so now I will pass it to Mindy Woods. Mindy is a resident in Seattle, Washington.
Thank you, Peggy. Yes, hi, I'm Mindy Woods. I'm with the Resident Action Project in Washington State, and I experienced homelessness in 2011, and I had a teenage son, 13-year-old son at the time, and we immediately called all of the resources in our county. We're just north of Seattle, so we're in Snohomish County. So we called all of the resources and was shocked to find out that on the 9th of the month, there was nobody that had any money left and nobody had motel vouchers and there was nowhere for us to go. However, we were put on a wait list, but it was 4 months away for a local shelter. So during those 4 months, we spent time bouncing from couch to couch, and several nights, I would make sure my son had a place to stay, but I would be in my car. And so trying to find a place that was safe for me to park, but also not call attention to myself. I wasn't trying to have the neighbors call the police or the police harass me, but I needed to also make sure that I was close enough to, services or, somewhere that was well lit. And as a single woman in the car, that's important. And so it was very stressful. And so then flash forward, when I finally did get housed, now I'm fortunate enough to be the human services program manager for the city that I live in. And in the last 2 years, when this job was created and I started working, May of 2020, so right after COVID hit, right away, we started seeing more visible homelessness, as everybody I'm sure has experienced as well as in their local areas. And so we started getting complaints from housed residents, and there were 2 particular unhoused people, both experiencing mental health issues. And we just could not find any available shelters. And with the CDC restrictions on spacing during COVID, it just made it that much harder to find enough beds in our county. And so for those 2 individuals, I couldn't find a single bed for either one of them. And the only thing that I was able to offer, which is not anything to offer somebody, but to say, there is a shelter that is in a different city north of here, we can, help you with a bus pass or try to figure out transportation to get you up there, but you have to wait in line with everybody else, go through an intake interview, and then hope that you're one of the 2 people selected for the 2 beds that they have. And that wasn't an option for either one of my 2 clients. And so we started getting more and more complaints from citizens that were tagging our city council. And one particular city council member who really has no idea about human services or poverty or any of the issues that we are talking about. One of the emails, one of the residents mentioned, well, one of the other cities in your county did a no camping order. Why don't you do that? And that right away piqued her interest. And so she went off of that email thread and started engaging with this resident and worked on an ordinance. And this ordinance that she was working on was going to be pretty cruel. It would not have been nearly as compassionate as the one that we have now. And the one that we have now that was just passed in May, my supervisor, human services supervisor, worked with me, and it was a very difficult situation for me to even have to partake in, because everything in me was against criminalizing homelessness. But if we wanted to make sure that we came out with the most compassionate ordinance, knowing that because of Martin versus Boise, it could not be enforced, we wanted to make sure that we had the right language in there. So we made sure to include storage of public property, to make sure that it was, that all of council understood this could not be enforced, period, because we do not have shelter in our city at all. And in fact, there is only one shelter in all of South Snohomish County where I live, and it's the very shelter I stayed in 11 years ago. It is only for women and women with children, and it's a 4-month wait list. So we really hammered on, if shelter is available that is appropriate and fits the needs of that individual, and then they refuse to go there, then the ordinance would be enforceable. But even our police department knew this is not an enforceable ordinance. But what we were hoping is that it would then get the support of our council, so that what they didn't know is in the back, behind scenes, we were working with our county to use ARPA funds to purchase a motel in our city, and then create a full wraparound bridge housing program. While we also had passed another bill that we got it passed to the state legislature 2 years ago, and it was up to local ordinance or local jurisdictions to implement. And it's where we would take 0.1% sales tax and apply that to affordable housing and behavioral health services. So we wanted to create some kind of bridge housing that would not have an expiration date on it, but that would provide full wraparound services with behavioral health services for folks to stay in, that was not a congregate shelter setting, because, certainly through COVID, I knew this already, having lived in a shelter that had to share kitchens with one side of a neighbor and bathrooms with the other neighbor on the other side. But we already knew that congregate shelter was not the ideal model. So we were really pushing for a motel that we could have in South County, and that we would have that bridge program to run parallel with this other 0.1% sales tax, that while we were looking at converting buildings or creating new resources for affordable housing, or truly affordable housing, income-based housing, then we would have that safe, stable place for people to be. And so the council had passed this ordinance locally while we were working with our county on this motel purchase. The motel purchase did pass the county council just last month. We are currently in the escrow process. This will be county run. So it didn't have to come from our city, and not a dime from our city. As a matter of fact, all the funds, again, were ARPA dollars. And they will be sending out an RFP shortly for organizations in the county to submit their proposals. and like I said, we will have access to behavioral health services, for food, for getting into the coordinated entry system, so that we will have housing navigators assigned to each individual. And this is a 50, I think it's a 50 unit motel, and it happens to be the very motel that my son and I stayed in for 6 weeks while we were waiting for the shelter to take us in 11 years ago. So it's a very full circle moment. But what we're finding and what we're hearing from unhoused folks who are very concerned with not only our local ordinance, but just, in the community in general, that are being harassed by police or residents, that, when you are criminalizing homelessness, you are absolutely exponentially impacting people negatively that much more. So the trauma of being unhoused in the first place is one thing, but then when you've got legal issues because you've been cited for trespassing in a local park, or you have financial fines against you. So that just, impacts all of the trauma. And so we are really, really cognizant of trying to make sure that our council understands and our police department understand that arresting people, we cannot arrest our way out of homelessness, that we are doing everything we can to find the appropriate resources for each individual. Some people have PTSD and can't go into congregate settings or a setting where you have multiple other people. Others have pets. We don't have a single shelter in our county that accepts pets. Others are families or couples or members of the LGBTQ community and don't feel safe in various shelters. And so we're really, really cognizant of the variety of needs that are out there, and really trying to customize best that we can, or personalize the kind of care that we are providing folks. And I can't emphasize enough that we cannot arrest our way out of homelessness, that continually criminalizing folks that are, these are crimes of poverty. There's as many reasons of why somebody is unhoused as there are unhoused people. And this is not about somebody being service resistant. I hear that a lot in the community. That's not it at all. But when you're offering somebody a bed in a congregate setting, when they've got the dog that has kept them alive for the last year, that's not an option for them. And they're not going to part with that animal. We shouldn't expect them to. We shouldn't even ask them to. So we are in the process of really trying to, create these programs, but at the same time, educate the public as to why we have folks that are, out in the neighborhoods and there's nowhere to go. So that's a huge part of this, is the education, and not just our public, but our elected officials as well. So anyway, we're making progress finally. 11 years it's taken to even get to this point, but I have to constantly remind myself that this is a marathon and not a sprint. And so I appreciate the time, and I'm happy to answer any questions.
Thanks, Mindy. And I don't know if you can see the Q&A box, but there are lots of thanks and appreciations for you being for your presentation, and for being willing to open yourself up in this way, to dedicate yourself to, like you said, this marathon and not a sprint of work. And so that's actually where I think one piece of this, right, is that all of our organizations are talking about engaging people with lived experience in our work. Can you help give some tips on how to do that, and how to do that respectfully, and what's been helpful to you in sharing your story?
Sure. So as I said, I am with the Resident Action Project, and that is a statewide network of people who have lived experience of housing injustice and housing insecurity and homelessness. And we are under the guidance of the Washington Low Income Housing Alliance. And so we recognized, as we were individuals were being asked to go down to our legislature and testify, that there was an opportunity to bring us all together, because like I said, we all had an individual story. But collectively, we had more power than we did as, individuals. So really bringing together folks with those lived experiences. And so even, yes, I've learned to use my voice. We all have a voice, but some of us have not been able to use that voice or have not felt comfortable in certain spaces to use our voice. And so I have gone to, one of the first places that I went to was back to the shelter where I was, and talked with the residents that are there and just let them know how their story, as traumatic as it is, it has power to create change. And that if we can bond together and support one another and rise up and lift up our voices and our stories, that we could use those stories at city council meetings or school board meetings or down in our legislature and or in testifying, that we could use those stories, because that is the part where I think the public doesn't understand. Why is there so many people out there? It must be something that they've done. They must made some kind of bad choice, right? But if we can continually tell these stories and explain the different circumstances, then it starts to open up those eyes and those hearts. And I think so many of our elected officials are, more loyal to our housed neighbors than they are to our unhoused neighbors. But if we can get those housed neighbors to understand just how complex this situation is and how they too are part of this problem and the solution, right? That this is a community-wide problem, but it is going to require all of us, the public sector, the private sector, all of us. But advocacy is about organizing. And so we really is maybe as much shame as we feel, or guilt or embarrassment, we really try to link arms with one another. Yes, we'll cry our way through many of our meetings, but we use our stories to impact the policies and create change. And so if I see somebody, and I have the opportunity to work with people all the time now. In fact, over the weekend, I've been working with a veteran who is unhoused, living in his car with his dog, and suffers from PTSD, as well as he is on the autism spectrum. So that need to follow the rules and make sure he's abiding by the laws, at the same time, at the mercy of the public and the mercy of human services. So just being able to reach out and identify with him. I understand what you're going through. I see you. And I didn't solve his problem over the weekend, but I just had a conversation. And that right there is one of the biggest things that I can say that every single one of us should be doing, is to look somebody in the eyes and just talk with them and let them know that they're seen and they still matter. And that goes a long ways to creating the sense of community, to where everybody still has that hope, and where, like I said, where the public is part of this process. I don't know if that answered your question.
Oh, absolutely. Yeah, that was great. I mean, I think especially where you ended, right, with just first remembering people are people and connecting with them as and connecting with folks, because we should care about each other is the first step. And really, and thank you so much for your presentation today, and for the work that you're doing. That's fantastic.
Thank you.
So our next speaker, so we've heard about some of the local challenges and threats that are emerging out in communities. Next, we're going to shift to what some of the long-term housing first successes have been, with a focus on how veterans have been how we've used housing first to house veterans. And we'll start with Catherine Monet, who is the CEO of the National Coalition for Homeless Veterans. Catherine.
Thanks, Peggy. It's really great to join everybody here today. As Peggy said, I'm Catherine Monet, and I'm with the National Coalition for Homeless Veterans. For those of you who may not be as familiar with us, we are a resource and technical assistance center for a national network of community-based organizations, largely, that provide emergency housing, transitional housing, supportive housing, and all kinds of other supportive services to thousands of homeless and at-risk and formerly homeless veterans annually. Today, I'm talking a little bit about housing first and ending veteran homelessness. And I think that's really important, not only because of the work that I do, but because it's really great to see good things happening for people who deserve it, right? And everyone deserves housing, but we've made a lot of progress on veterans. So I think for those of you who closely track the federal benchmarks and criteria and are geeks like me, right? You know that 83 communities and 3 states have actually met the federal benchmarks and criteria for ending veteran homelessness. And when you think about what that means in terms of absolute numbers, right? It means that we've seen a 50% decrease in the last decade on any given night of veterans who are sleeping outside or in transitional housing. So when you look at the last reliable, data that we had on veteran homelessness from 2020, it was just over 37,000 veterans experiencing homelessness on any night, which is a lot better than it was, but still a big challenge for all of us to work together to solve. When I think about what has really led to this decrease, there are a couple of big buckets of things that had to happen, right? And I do think the first thing was really dedicated coordination and leadership at the national and local level, right? So thinking about the ways that the federal government has leveraged both its power and leadership to encourage local communities to do that, in the ways that local leaders and partners such as yourselves have really stepped up to the plate and said, yeah, we think we can do this and we need to do it together as a community. The second big bucket of things that happened was really looking at how we invest in key federal programs and scaling up our investments to try to better meet the demand for what we're seeing in communities. And I think the third really key thing was focusing in on what works, right? So continuing to do the research and do the work, and to really implement evidence-based practices like Housing First and continue to refine the way that we do that to better meet the needs of the communities. So when we think about really what that means in practice, right, I think all of you know that our system of care for veterans experiencing homelessness has changed a lot in the last decade. And we sort of went from a place where, we predominantly had transitional housing, service-intensive transitional housing, to now having a lot of different tools in our toolbox to meet those needs, right? So we have a lot of HUD-VASH vouchers now, which is really great because permanent supportive housing for veterans is important. We have a rapid rehousing program for veterans called Supportive Services for Veterans and Families, and its flexibility is really key. I think a lot about when that program was first started, and it was envisioned to be, I think, a $20 million program annually, and it's now grown substantially over the years. So we're looking at what is now around, upwards of a $700 million program per year, which is great, right? We need to continue to scale our investments in these programs that support rapid access to housing so that folks who need that can still access that. But I do think that one thing that's really different about the veteran system is that we have not really ever lost out on a ton of our transitional housing, right? Instead of getting rid of it, we have really shifted to make our transitional housing a lot more housing focused and housing oriented, so that we can be sure that veterans have access to their choice, right? And we can respect their needs. If you want, a housing oriented option like rapid rehousing or permanent supportive housing, great. But if you are a veteran who maybe wants to work on some issues first, that's great too. And we've got options for you. When you think about another thing that's unique about our system of care for veterans that kind of makes it different than what you might see for civilians, it's really that the VA system is large, right? And it's the nation's largest healthcare system that is also funding and to some degree operating permanent supportive housing projects, which is amazing, right? I can't think of any time when I've ever been to the doctor, and I'm not a veteran, so I can't think of a time when I've ever been to the doctor and they've asked me about my social determinants of health, like what am I eating and where am I sleeping? But, when you think about the ways that that helps the healthcare system writ large, right? It helps them because they can deliver better healthcare when people are housed and when people are fed and when people are getting their basic needs met. And it just makes a whole lot of sense. But really for veterans, what that means is that there are really robust supportive services that can come with the housing placement, right? So the pairing has been really effective for folks who are in need of longer term services and supports, and also those who are looking to connect to the suite of services that veterans might be seeking out. Because one of the things that's really great about the veteran system is that, you can come in requesting healthcare, and you can leave with a housing voucher, connections to dedicated employment services, access to other resources that you might not have even known exist, like disability benefits, the GI Bill, and things that, just kind of holistically wrap around a person in need of supports. And I do think that that's something unique that has really enabled us to have the success that we've had in terms of decreasing veteran homelessness. When you look at the research on Housing First for veterans, what we've seen is that, the implementation of Housing First has really decreased our time to placement, right? So it's decreased the length of time that somebody experiences homelessness before they can move into housing. We've seen that housing retention rates have increased, so people stay in their housing longer when they have the supports that they need and want. And VA has also seen that emergency room usage among veterans who have been placed in housing has decreased dramatically. There are a whole host of other benefits, obviously, but if you are in a community that is still maybe on the fence, and I hope nobody is, but if you are in a community where folks are looking for other options or looking at other less successful options, I do think being able to point to the VA system and the successes that we've seen there can be really critical, because we've seen those successes nationwide in communities across the country, right? It's not just a coastal states type of issue, right? I mean, this is something that's been implemented in every nook and cranny of this country. Now, one of the things that we've seen at VA, right, is that Housing First is most successful when we're seeing multidisciplinary teams offering case management, and where the case management is able to be co-located with housing, or is sort of more hands-on than it could be in scattered site housing, for example. And I do think that, that's something to think about, right? The services side. And I know that it's important for all of us to really hone in on the availability of affordable housing, and, the ways in which we make that affordable, or the ways in which we make housing affordable to people. But I do think that what happens when folks are in that housing is also really important. And to the degree that people want supportive services, we ought to make sure that that is a part of the conversation. Now, when we think about what all of this research looks like, right, in practice, I do think that Housing First has really been the accelerant for many community-based efforts to end veteran homelessness, right? Where we've seen local leadership and everyone sort of working towards one goal and rowing the boat in the same direction. That's really important. We've seen a lot of work to understand who is out there experiencing homelessness in communities and what they need to end their homelessness. And I don't think this is a spoiler, but it's housing, right? Like, housing ends the homelessness, and we've got to make sure we're delivering that. We've seen a lot of really great partnerships, but at the end of the day, it is the relentless focus on housing that has been kind of the game changer for communities that are working to end veteran homelessness. And I think adopting the Housing First mentality and mindset in your community efforts has been really critical. There are so many communities that have been profiled in their work to end veteran homelessness, but I do want to just highlight a couple. And I think some of these are, not the most recent communities that have ended homelessness, but one thing that stood out to me when Des Moines, Iowa ended veteran homelessness was the way that they had highlighted the fact that, HUD-VASH and SSVF resources were really critical, because they had so many more veterans, or they had so many more resources for veterans than they had for the civilian population. And for them, utilizing those housing-focused resources were really the game changer that allowed them to end veteran homelessness. I do think a lot about Las Vegas, because Las Vegas was interesting in that, they really focused in on housing placements, but partnership was kind of the key that allowed them to push themselves over the finish line, right? When you think about the fact that, the VA healthcare system and the system of care for, veterans facing a housing crisis is great. One of the things that comes with that is that not every veteran is eligible for a variety of reasons, whether it's your discharge status or the way in which you might have served in the Guard or reserves. And, some of our programs have different eligibility criteria based on your veteran status. But one of the things that I thought was really interesting in, Las Vegas and even other communities that haven't achieved the federal benchmarks and criteria is that during the course of their work, they were able to look at their population and identify additional housing-focused resources, like just general Section 8, and prioritize that for veterans experiencing homelessness, so that they could actually achieve this really big goal in their community. And so, you know, as we think about partnerships and housing first, right, it's not always just that the VA system will be the bringer of resources for veterans, right? It's that you can look at a whole bunch of resources and really prioritize them. Peggy, are you coming back to give me the hook?
Only just a little, yeah, it's just a subtle, like.
Okay, no, that's
Couple
fine.
minutes, just a couple minutes.
I only have like 3 more things to say, and I wanted to talk a little bit about the challenges for veterans, because I think the first one is that vouchers are getting really hard to use because we're in a crisis of housing affordability. And so I do think that everything that Peggy and Diane emphasized at the beginning of this call is important. Like, we really need all of you to go out and advocate and ask for all of the resources that everyone needs, right? Or we're not going to be able to make an impact. The second big challenge that we have in the veteran system is really looking at case management and how we can identify, you know, more services and supports within VA. And the last thing I wanted to highlight was that continuing to innovate around housing first is really great when we think about the ways that we're utilizing HUD-VASH now in pilots for veterans who are aging, or the ways that SSVF has kind of changed to offer shallow subsidies and longer term supports for people who may need them. But that is all that I had. So if folks have questions, I will gladly take them.
Great, thanks, Catherine. Catherine, do you mind if I have John go now? And then that way we can do the vets questions together, so you guys can riff off each other if you need to.
Yeah.
Okay, thank you for that. So, so our next speaker is John Meyer, who is the Support Services and Veterans Families Program Manager with West Central Texas Council of Governments. John?
Hello, I appreciate everybody attending today. I am a program manager, again, with the Supportive Services for Veteran Families in basically in Abilene, Texas. We are in West Central Texas. In 2018, we joined with Community Solutions in the Built for Zero initiative, and reached functional zero within that same year in November. In 2019, we were recognized by the United States Interagency Council on Homelessness as ending veteran homelessness. We definitely look at all of these things as far as housing first and our success with it. I think the VA has always been very forward thinking as far as the utilization of housing first. We've been operating this grant since 2012. We've been operating under Housing First initiative. It's something that when you kind of hear it discussed in the community and nationally, like Housing First, it's like, well, of course, Housing First, but it's something that you have to be able to drive and bring to the rest of your community, and really be the voice in the community of how important Housing First is, how precious it is, and the amount of judgment, I think, and that it withdraws from your system, removes a lot of prejudices and judgments, that it's just, to me, it is everything that we do is just, it's all about housing first. It's not about meeting any preconditions, you know, and also, you know, the realization that housing first involves all kinds of other things that are involved with it, all kinds of other services, and that those services are scaled based on need and also choice. Basically, that all of our clients have that autonomy and we respect it, and that it is, you know, something that we find most important. And I think, you know, that lived experience aspect of it. In 2014, I experienced homelessness in my community as a veteran, and it was the VA, when I was receiving medical services, that connected me to HUD-VASH and Supportive Services for Veteran Families, that allowed me to quickly gain access to housing, to really have stability and move forward. And I think it's just, when I look at it, like what we provide for veterans is just, if we could scale that into the rest of our populations. So even when I look at the services that we provide, many of the wonderful services that Catherine mentioned, but, you know, like homeless prevention services, in the sense that we have a program in place to help veterans remain in housing. So we have the ability to work on the inflow of our homeless veterans, but at the same time, help our inflow problems, that we don't have as many veterans falling into homelessness, that we can work on keeping them in housing, that we can work on, maintaining our inflow and outflow levels and kind of maintain a strong functioning system. I would say that all of these things are, everything that we do is about building relationships and communication, and basically that we're open and honest and truthful, and that we respect our clients' choice when they're homeless, and really just kind of build upon those relationships. And for me, I look at it like that. I don't know. It's just, I can't imagine where we didn't operate in Housing First, but also like one of the other services that Catherine talked about, having the shallow subsidy program available so that longer supports are in place, that supports are in place that can allow veterans to find a way to bring more income into their household and not lose that availability of that support for a 2-year period. I mean, that's amazing. I mean, because with a housing choice or HUD-VASH voucher, you could potentially lose that voucher with increasing the income in your household. Well, what better way to encourage a household to increase their income and bring more stability in that household than basically providing them a rental subsidy for 2 years that isn't based on if they increase their income? Wonderful. That's the one of the primary goals of that program. So I think that many of the things I see within the VA and with the housing programs for veterans, if we could bring even a portion of those to the rest of the population, I think it would be wonderful, and you would see greater reductions in our total homeless population.
Great, thanks, John. And so I apologize for my dog in the background. Catherine, are you there to come back on? I think we have a few minutes for questions. So one question, Catherine, I'll start with you, and then John, if you can talk about locally. There are a couple of questions in the Q&A box about case management and working with the VA system around case management. And so, in some communities, this has been a challenge. And can you talk about that and what you've seen work when it comes to the VA system and the case management piece?
Yeah, so I think case management, I don't know. I think the old adage in my world, right, is that if you've seen one VA, you've seen exactly one VA, right? Like they all do things very differently. I do think that successful strategies I've seen include broadening the number of practitioners involved in your case management team, right? So some HUD-VASH teams are just clinical social workers, and others have other specialties from within the medical center engaged, whether it's your, occupational therapy folks or other folks. Some folks have peers included. Some VA medical centers even look at contracting with community providers in order to just bring more effective case management on board. And I do think that during COVID, we've seen some really interesting strategies where VA has been using some of their rescue plan funding on recruitment and retention bonuses, and I think even moving costs for, social workers to come in and support the program in areas that are very, very, very hard to hire in. I think predominantly in rural areas, but I do think more of that would be helpful from a global perspective.
John, what's worked in your community specifically?
I think what Catherine is stating is true, that I think there always is or has been issues since I've been involved with the VA and that HUD-VASH case management part of the program. I think it's difficult in the sense that coming from a veteran perspective, like you work on building that relationship with your social worker, and then the next thing you know, they're gone. And then you're waiting around for that replacement, and then you finally get it, and then they're gone. So that is, I think, one of the biggest struggles probably with dealing within that HUD-VASH world of case management. and those social workers, their availability and having those positions filled. I see like locally that we have, it always seems like we have a shortage, and it seems like that the social workers that are there are probably extremely overtaxed. I think, you know, what we try to offer when we work in a kind of joint case management strategy with, as far as like what we can offer when we're working with the kind of the same clients, a lot of times we try to offer assistance in what we can do and what we can provide and guidance. And because a lot of the veterans that we're working together on are, you know, we have developed those relationships on our side and they've developed them on their side. So if we can step in and assist, we will. And I think it's just beneficial that, you know, that our veterans who are receiving service, that they have a trust and faith in the persons that they're working with.
Right. Oh, and John, I meant to do this. As a Texan, I know what West Central Texas is, but can you let folks know where that orients itself in the state?
Yes, ma'am. We it's almost central West Texas, but if you look on a map and you see where like Fort Worth, Dallas is, we're about 2 hours west of that areas. So it's kind of you know, it's kind of like you start getting very rural. Our population is about 124. It's considered obviously urban to an extent, I would say small urban, but you know, we are kind of surrounded by extremely small rural towns that kind of depend on Abilene in for many of their services, and many of whether it be medical or, you know, all kinds of things. Kind of Abilene is that hub for those smaller surrounding rural cities.
Perfect. Thanks. I just knew that not everyone knows where central, where I wanted to orient them a little bit. And I have friends that work at the Dallas VA hospital, so I go out there occasionally. So Catherine, this having you lead with this question would be great too. There's a question about serving older adult veterans and what you're seeing and observing when it comes to how that works in the homelessness space and the connections to personal care or nursing homes when that's necessary. What are you seeing in that space?
Well, I think we're seeing rising challenges, and we're actually, as an organization, embarking on an effort. We just brought on a research fellow to kind of help us unpack that. But what we are seeing VA do is look a little bit more at how they can use Section 8 vouchers and sort of this combined or collaborative case management model, right, within the VA Medical Center to bring more geriatricians on board to support older veterans so that they can age in place with a voucher potentially, and eventually at some point maybe folks can transition into, you know, your community living centers or your state home if that's what they need. But I do think that there is a really big gap there that we're hearing about from all the providers in the veteran space.
Don, is there anything that you'd want to add on that point around older adults?
No, I mean, I definitely see that. I would say since I've been doing this since 2014, that a majority of our homeless neighbors coming into our system have been older adults. And I think we've had the wonderful blessing of being basically officed in the same space as our area agency on aging, who's usually able to provide some assistance, and then working with the VA to try to kind of piece in and fill some of those gaps. But there's always going to be struggles.
Great. All right. Thank you, Catherine and John. We really appreciate it. Great presentations from both of you. And with that, we'll end today's webinar. I want to thank our presenters for taking the time to join us today, and for all of you for participating. We'll collect the questions in the Q&A box, and folks will try to get back to you on answers to those issues. I want to just kind of highlight what we heard today around, you know, a helping us know how we can help you work at the state level, at the local level, and at the federal level to make sure that we're advancing the housing first as a solution and the long-term strategies around service connection, rental assistance, and adding to supply that are needed to solve homelessness for our neighbors who are unhoused. Thank you all again for participating today, and please join us for our next webinar on September 26th that will dive into, again, housing first and homelessness and our efforts to end homelessness. Thank you very much.